Welcome back to the Deep Dive. Today, we're going to uncover a really remarkable initiative, something that's making a profound impact on, well, a critical global health challenge.
That's right.
We're talking about severe mental illnesses like schizophrenia,
Mm.
that complex condition affecting thoughts, feelings, behavior.
Yeah, deeply affecting people's lives.
Exactly. So, this deep dive, it's basically your shortcut to understanding a pretty groundbreaking approach. It's achieving real change where it's so desperately needed.
hmm
We're zeroing in on an extraordinary program called the Solol program. It operates out of Larkana in Sindh, Pakistan.
Yeah, and our mission today really is to explore how this specific community-based program is tackling this, significant mental illness and doing it with innovative, low-cost solutions. The results they're getting are tangible and honestly could inspire similar efforts all over the world. So we're going to break down its unique structure, look at the impact, and really try to understand how it's actually breaking down these long-standing barriers, both in healthcare and, how society sees these things.
Right. Because when we talk about mental health, it's obviously a global issue, but it's often, severely neglected, wouldn't you say?
Yeah,
Especially in developing countries. Resources are just scarce.
definitely. Very scarce.
So try to imagine, just for a moment, what a truly effective community-led solution might even look like in that kind of context. What sort of unique challenges would it have to overcome?
Yeah, what would it take to deliver consistent care and support? It's a tough
It
question.
is.
And what's so insightful here, I think, is how the Soul program offers a really compelling answer. It is unique, innovative, and it's a charitable, community-based outreach program,
Okay.
specifically located, as you said, in Larkana, Sindh, Pakistan. And its core focus is, well, it's the recognition, diagnosis, treatment, and psychosocial recovery, specifically for patients diagnosed with schizophrenia.
That sounds incredibly focused and well-established for a community program. What was the driving force? How did they get it off the ground and build such a robust foundation?
It came about through a really powerful collaboration. It was between the psychiatry department of Shahid Matarma Benazir Bhutto Medical University
Okay.
and the Sindh Doctors Association UK. Now, that's a registered charity, doctors from Sindh, and they've actually been active since 1979.
Oh, it's a long history.
It is. So the SOUL program formally launched in January 2011. And as of August 2023, it had entered its 12th year of operation.
12 years.
Yeah. And what's also notable is the scale. They have a caseload of nearly 200 patients diagnosed with schizophrenia.
That's incredible, both the longevity and the reach, especially for such a targeted program, given, all the challenges of mental health care delivery in many regions.
Absolutely.
What were some of the biggest hurdles right at the start? I mean, particularly gaining trust in a community that maybe was wary or just misinformed about mental illness?
Yeah, that was a huge one early on. Overcoming those deep-seated myths and the stigma around mental illness. It often led to, isolation, neglect for patients and their families. But the program's core vision was precisely to address that, to be an indigenous and innovative mental health initiative. That's how they frame it. Designed to demonstrate a low-cost model for delivering care and psychosocial support, particularly for schizophrenia and other psychoses.
And the key word.
The key was engaging directly with the local community and, crucially, with the families, building that trust, really, one interaction at a time.
Okay, so let's get into the operations then. How did this program actually deliver such comprehensive care? What's this multi-pronged approach you mentioned, the one that addresses sort of the full spectrum of recovery?
Right, that's crucial to its success. It really starts with an initial home visit.
At home, okay.
Yes. A Soul Team psychiatrist and mental health nurse, they go together, conduct a joint assessment, they figure out the diagnosis, the treatment plan.
Right there in the whole environment.
Exactly. And then that's followed by regular home visits and ongoing monitoring. So it ensures continuous support right where the patients live. The core insight, I think, is that effective care isn't just about clinics. It's about weaving that support right into the patient's daily life and environment. That fosters continuity and it builds that essential trust.
Makes sense. And beyond the sort of clinical side,
Mm-hmm.
who else gets involved in this support system? Is it mainly focused on the individual, or do they bring in a wider network.
Oh, absolutely. It's much broader than just the individual. There's very active communication and engagement with families and immediate caregivers. That's fundamental.
How do they do that?
Well, it includes providing, essential education, information on how to support people with psychosis. They even host regular family assemblies.
Assemblies, interesting.
Yeah, to foster a kind of collective understanding and build a support system around the patient. But what's particularly powerful, I think, is how the program goes beyond just treatment. It aims for social recovery.
Okay, social recovery. What does that entail?
They offer vocational skills training and education. This happens at the Faizan Mental Health Rehabilitation Center.
Right, you mentioned that.
Yes, it's a multi-purpose center, started operating in January 2022 right in the city center of Larkana town. And it uses acquiring vocational skills as a medium, really, for psychosocial recovery.
So practical skills leading to broader recovery.
Precisely. And it's not just for schizophrenia either. It also aims to build capacity and empower patients recovering from bipolar disorder, condition with significant mood swings, and also severe anxiety and depressive disorders.
That's quite a scope.
It really highlights a critical insight. True recovery isn't just about reducing symptoms. It's about restoring dignity, purpose, the ability to reintegrate into society.
So, okay, connecting the dots then. How do these operational details translate into actual, tangible outcomes for the patients, for the community?
Yeah.
What does this whole integrated approach really achieve on the ground?
Well, the impact metrics are, frankly, quite impressive. They really speak volumes. This whole service delivery model, it offers a truly pragmatic and, importantly, low-cost solution to what is a very serious gap in mental health care provision.
Okay. And clinically?
Clinically, they've seen remarkable success. Roughly 2/3 of patients have achieved symptom resolution.
2/3. Wow.
Meaning the most acute, debilitating effects of their illness have significantly lessened or even disappeared. But it goes further.
How so?
Nearly 30% of patients have achieved what they call functional recovery.
Functional recovery, meaning?
Meaning they're able to participate more fully in life again, rejoining families, engaging in work, living with much greater independence.
Those numbers are incredibly powerful. I mean, it's one thing to treat the illness, clinically speaking,
Right.
but quite another to help people genuinely get their lives back, rejoin their communities, especially in a context where mental illness often carries such immense stigma.
Yeah.
What does that level of recovery actually mean there?
That's exactly where the program's impact goes beyond the individual. It starts to transform the community itself.
How is Soul facilitating that shift in perception?
Well, crucially, the program has visibly impacted perceptions and attitudes, not just of the patients themselves, but their families and the wider local community. The myths, relating to psychotic disorders, they're actively being broken down. The positive impact of the treatment is very visible now among families in the community.
So people are actually seeing the recovery.
Precisely. Imagine living in a community where mental illness is misunderstood, maybe even feared. Then you see your neighbor, your friend, someone you know recovering, contributing again. That visual evidence, it's incredibly powerful.
Yeah, I can see that.
It dismantles that stigma, fosters acceptance. This program isn't just treating an illness. It's genuinely transforming societal understanding, creating a more compassionate environment.
And it seems like they're not resting on their laurels either. How is the Soul program looking to expand its reach, its impact for the future, building on this incredible foundation?
Yeah, they're definitely forward-thinking. It shows how this kind of model can scale, actually. The program has planned to start a Soul telepsychiatry initiative.
Telepsychiatry. Okay, tell me more.
They'll be running telepsychiatry consultation sessions for the local community in Larkana. For diagnosis, for treatment of various mental health disorders, these will be hosted at the Soul program head office on weekends.
So leveraging technology.
Exactly. It's not just about expanding reach. It's about using tech to overcome geographical barriers, bring specialized care directly to communities. That's a really innovative leap, especially in regions with limited mental health infrastructure.
Definitely. Who's providing these consultations?
And this is where the global collaboration aspect comes in, which is also quite inspiring. The consultations will be offered by a team of experienced, qualified consultant psychiatrists from the UK, the USA, other places overseas.
Wow.
And they'll be volunteering their time at their convenience.
That's an incredible way to leverage global expertise for local impact, a real bridge for knowledge and care. And just a note for any clinicians listening, if you're interested in potentially volunteering for this telepsychiatry role, you can email soulprogramarcana gmail.com. We'll put that in the description.
Yeah, it's a great opportunity. And it really shows the power of this model, doesn't it? It's not just providing care, it's creating this self-sustaining ecosystem for mental health support.
How so? Self-sustaining.
Well, the income and any proceeds generated from these telepsychiatry consultations, they go directly towards the charitable fund for the Faizan Nazar Mental Health Rehabilitation Center.
Ah, okay. Supporting its work.
Exactly. Supporting its crucial work, ensuring it's viable for the long term. It's kind of a blueprint, really, for adapting mental health care to diverse cultural, socioeconomic realities around the world. It shows scalable principles for underserved populations.
Okay, so let's try to sort of recap our deep dive into the SOUL program here. We've looked at this innovative, low-cost, community-based approach in Larkana, Pakistan. We've heard about its really impressive results both in symptom resolution and that crucial functional recovery, and how it's actively dispelling myths, changing perceptions around mental illness right there in the community, family by family.
Yeah, I think this deep dive really shows that comprehensive, impactful mental health care doesn't always need immense resources. Sometimes it needs, well, innovative thinking, deep community engagement, and just a relentless focus on holistic recovery.
Getting the whole person back into life.
Exactly. It's a truly powerful model for change, demonstrating how localized solutions can tackle these huge global health challenges really effectively.
Which leaves us, and you listening, with maybe a provocative thought to ponder.
Yeah.
How might these kinds of low-cost, community-driven models, like the SOUL program, reshape mental health care in other underserved regions around the world? And maybe, what role could you or we play in supporting such vital initiatives?